Hello, good morning, everyone. Okay, so how are you all this morning? Hope all are fresh. Nice to see you all in this morning. Okay, so even I'm very fresh because it is like early morning. So I'm excited to talk to you today, and also I would like to introduce myself. My name is Gunajoti, and I am a senior trainer here for NCLEX and also the coordinator for NCLEX RN courses. So today I am very happy to talk to you, to know about you. So let's just have a little bit of information on NCLEX RN. What is this exam and what are the types of questions that you might get and what is today's topic on? Okay, so it's something that what we are going to look into. Fine. So yes, so maybe that you have an overall picture of what is NCLEX RN. Okay, so today I'm going to give few points on what is NCLEX RN and what are the things that you will be learning when what is that course that we are giving for a candidate so that you become more practiced. So knowing NCLEX RN and learning NCLEX RN is something different. Agree with me? Yes? Yeah. So that is what today I'm here to give you some information on what is NCLEX RN, then how we conduct that training for you, and what we teach you in our NCLEX RN training. Okay, fine. So as you all know that NCLEX RN is a national council licensure examination for registered nurses. Okay, and this is internationally accepted or recognized licensing exam, especially for countries like the US, the Canada, and Australia, as you know, to work as an RN. So RN people, whoever is going to work there in United Kingdom, United Nations of state, that is USA. So they need to know this particular exam, pass this particular exam before they go and work over there. Okay, but for that you should have your preliminary criteria that is fulfilled. That is, you have to be a graduate nurse who has completed your nursing in your hometown and you have that license and you are also working, right? So that is the preliminary things what needs to be done from you. So only when you are a nurse in your hometown, then you can take this particular exam and you can go and work in other countries. Okay, so rather than it is an exam, I would tell that it is something like which makes or which assists the nurse for to know how well competent is the nurse, how safe nurse you are. Okay, and as a nurse, how you can do that critical thinking, as you said. Okay, and provide an high quality care for your patients, and how safe nurse you are. So that is just very, very important when you are answering these questions that is related to NCLEX RN. Okay, so you have to be very, very careful to think like a nurse, maybe that nurse who's in that situation, and then answer your questions. Okay, so NCLEX RN, as you told, is a computer based adaptive testing. So it gets adapted to the knowledge level of the candidate who is doing that particular examination. So it possesses that it assesses whether you possessing that knowledge, the skill, and that critical thinking ability. So that is how it goes on. Okay, and you know that the how the exams are being conducted. So it is through the computer adaptive testing. It is a computer based examination what you are going to do, and the examination pattern is organized in such a way that it has the whole examination. So that examination is nothing but your nursing subjects itself, but it is based on the client needs. So every question will come under the client need categories. It is called as client need categories. Like you have management of care, you have safety infection control, you have health promotion and maintenance, you have psychosocial integrity, basic care comfort, reduction of risk potential, pharmacology and the parenteral therapies, and you have the physiological adaptation. So like this, you have different categories of client based needs, and based on that needs you will be what you call assessed how good you are in your nursing knowledge. Got it? Okay, so this is something very brief, or it is not very depth. It is a very shallow information what I have given. Okay, so when you think of this examination, so it is not just like, you might think that I'm a nurse. I have studied my nursing, and I can just go and do my examination of NCLEX. Yes, you know that it is a nursing subject, but you should also follow certain standards that is related to these countries. Okay, you should understand in their perspectives. So you should know, like, when I have to give an NCLEX RN, in what way I should be thinking. So as I told you, that critical thinking aspect, the skills, the knowledge is little slightly different. So for that, you need to first understand the curriculum. You need to understand what is the question type patterns, because it is not just like, multiple choice questions. It has its own set of questions, like you have select that all, uh, select all that is present, that is what you call select all that apply. Then you have select whatever, drag and drop. Okay, then you have something like highlight the table, highlight the text. So you have different question patterns. So we will be talking to you on those question patterns during your classes, and we will be explaining a case study. Okay, apart from your classes, so daily classes will also go. So along with that classes, every day there will be one case study. Every day there will be questions which we are discussing with you. So every day there will be something that we are doing new, like exclusive QA sessions, exclusive SATA question session. Like this, we have different things that is being included in our course. Okay, so we provide professional NCLEX Professional Plus course. Then we provide NCLEX Essential Plus course, and we also provide something called as hybrid course. So NCLEX Professional course is an in-depth knowledge what we give for a fresher who do not have much clinical knowledge, or people who are like, who want to go in depth and study. For them, we go for the NCLEX Professional Plus course. Essential Plus, that is NCLEX Essential Plus, is something like we give classes, but we don't teach on the, what do you call, case studies. We don't discuss on the QAs daily. Okay, so like that, we do not have that particular facility in NCLEX Essential Plus course. And hybrid course is something that we do it for people who have better knowledge, like you, who already have a knowledge on NCLEX, who have already done a study on NCLEX, but they just want to practice questions. We give them only QA sessions. Got it? So we only discuss on the QAs. That is, we have set of QAs, like every week we have 2 day classes for that. So on that day, we only discuss questions with that. Okay, so that is called as NCLEX hybrid course what we give. The professional course will be from Monday to Friday at 8 to 9:30 in the evening. And the Essential Plus course what we have will be every day from Monday to Friday. One class will be conducted in the morning at 11 to 12 o'clock, and in the evening 6 to 7 o'clock. So whichever class is feasible for you, maybe you have duty in the morning, so you can attend it in the evening at 6 o'clock. If you have the evening duty, you can attend in the morning. But for Professional Plus, we do not have 2 times. We have only one class, that is from 8 p.m. to 9:30 p.m. Okay, so this is some little basic information that we have in our the courses that we have in our institute. So we also have trainers who are being certified and who will be teaching you. Okay, we have a person who's coming, who is trained and was working in US itself, and she is also will be a part of the training thing. Okay, so we have trainers who will be taking classes for you every week. There will be one trainer who is conducting it, and we also give you practice daily on the questions for the topic that is being done. Say, for example, today you're doing a cardiovascular system. Maybe cardiovascular system is not done on the same day. It will be having, like, 2-3 days. Cardiovascular will be taken for one entire week. So you have to learn that week subject entirely. Okay, so that is about cardiovascular. And then every day you will be given questions specific to cardiovascular, and it will be discussed to you. Clear? So that is how. So this is how we will be doing our NCLEX RN training to you. Fine. So today I would like to just discuss few questions to you. Today's topic is, we have chosen to discuss with you, is on safety and infection control. So this is one part of your NCLEX examination. This particular topic talks on like how you have to be a safe nurse. Got it? So we all are a safe nurse, but when you talk about NCLEX RN examination, it talks more about safety of the patient. So safety nurse is always one they are considering. Okay, so I'll just discuss few questions with you. You can see the questions, we will discuss, and we will just learn like what type of questions you might get, how you have to approach these questions, and how you can be most successful in this examination. Okay, fine. So let's start. Are you ready? Any doubts to ask so far related to our say course or anything you have? Any doubts? Or shall we go into the discussion of this particular topic? Anybody?
Continue with the topic.
Okay, fine. Thank you so much. Yeah. So as I told you, today we will be talking on one of the client need areas. That is one part of your NCLEX RN examination, which is called as safety and infection control. So when you talk about this particular topic, this topic covers about your isolation techniques, about how to control infection. So I will tell you a few things on this, and then we will discuss the question. And before that, I would tell that in your examination, 6% to 12% of questions will be from this. That is from safety and infection control measures. So as we know, as I told you, safety is something like very important, because safety is always important to be given to a patient. Because when a patient comes to us, they want to come and get relieved of some problem and go. So we should not be a person who is giving some problem for them, right? So that is where your safety plays a major role. So you have to be very careful to take care of them, to prevent from any falls, okay, to do any kind of medication errors, right? Or in case of say for example, if there is a fire, okay, how to handle your patients during the time of fire, okay? And in case the patient is having some problem, how do you assess the patient and how do you prioritize the needs of the patient is important. So you know that your patient is having a problem. You should understand what is the first need of the patient. So you have to think in the form of ABC, that is airway, breathing, circulation. How you have to prioritize them. Okay, so which action you should be taking first. Okay, so that is how you will be learning. So as you know, this safety and infection control is something that a patient will be, as a nurse, you will be following every now and then. So you will be talking about the standard precautions of how to, how you have to, follow in your hospital. Okay, contact precautions when you follow this, why it has to be needed. Okay, how when you have to wear this personal protective equipments. Okay, so these all are important. So along with your safety, the infection control is also an important part. So when you have to use your gloves, why you have to use your gloves, then when you have to take care of the patients when they are in distress, or when you have to, what type of fall risk measures you have to provide, what type of safety measures you have to provide. So these all things will come into this particular thing. So it's the same nursing subject, but it is categorized under this heading. Okay, so today we will be seeing few questions. So once you solve these questions, you will be understanding why this particular topic is important. Got it? So the first question here tells that a nurse is working on a busy medical surgical unit when a fire breaks out in the trash can in a client's room. what is the priority nursing action? Okay, so there are four options: pull the fire alarm, remove the client from the room, contain the fire, and get the fire extinguisher. So what does it mean? So first, let us see the question. So every question will have a scenario and a stem. So the stem is the one which is asking the question. The scenario is something which is explaining the situation of the patient. So here the patient is the nurse situation. Here the nurse is working in the busy medical surgical unit. So think of the medical surgical unit. I don't know in which areas you people are working, but any area you work, you just think the setup, what they are asking here. So medical surgical unit, think what all will be there. Okay, you can think of, is there any fire hazard, electrical hazard, fine, fall hazards. So all these things you can think of. So suddenly what happens? There is a fire breakout in the trash can in the client's room. So what is your priority nursing? So the word priority is what is important here. So they're not asking what is the nursing action that you will do, but here they want to understand the priority nursing. So when you see the options in your NCLEX RN, all the options looks the same, isn't it? So you feel that it's rather than telling same, you feel that all are important. Pulling the fire alarm, removing the client from the room, containing the fire, or getting the fire extinguisher. So when we talk on the safety basis, always you know that the patient safety is important. The patient comes first before you do anything. So if you have to do something, what action you can do for the patient is what we are going to see today. So what is the action that you can do here? So here you might think that you have to first go and do a fire alarm. So you might think that if I alarm that, the person will come and rescue. But by the time the person comes, your patient will be under problem. That safety measures is not taken. It is compromised here. So here the option would be remove the client from the room. Okay, why? Because this tells that the priority action is to rescue the patient first. So we teach you in the class like why rescue is the correct option. We tell you like what is the criteria behind selecting this particular question. Maybe rescuing the patient is a priority because you know certain patients will be immobilized, they'll be under mask, they'll be under so many things, so they cannot get up and easily run. So first priority should be that they should be removed from the place of fire. So once they are removed, then you put the fire alarm. So you should know in which order you should be taking care of your patient, so that the patient life is saved and they are safe in your hands. Okay, I hope you understood. So in depth, we will be teaching in the class. So right now, I can give you that safety is that the patient should be removed from the place where they are having the fire, so that they are not caught in fire. They are not having any fire accident. They are not getting burns and they are not getting suffocated. So they will be safely removed from there. Maybe later they can come and confine the fire. Okay. So now let's go to the next question. So here I would like to talk about the question that is talking about like what type of precautions you should be following. So you are a nurse working in an ICU caring for a 62-year-old male who was prescribed vancomycin for an infection. So he develops persistent watery diarrhea. So which of the following precautions do you take? So here we are going to talk about the infection control measures. So what type of precaution you should be taking? So the first option talks you about sanitizing your hand before and after entering the room, because you know that person is developing persistent and watery diarrhea. So you know now what is the problem. Fine. So here they are telling sanitize your hands before and after entering the room. Second option they are talking is place the client in a negative pressure room. Okay. The third option is wear a 95 N95 and a face shield when entering the room. Use single-use equipment and leave it inside the room. So when you think this, all looks similar and all looks that, okay, fine, this person has a diarrhea, you should know what type of things, precautions you should be taking. But there is particularly we teach on the kind of precautions that we taken. So we have what precautions? Airborne precautions. Fine. We also have droplet precautions. We also have standard precautions, what has to be followed. So here in this particular case, we are talking about that the patient is having persistent watery diarrhea. So in that case, what is your measure? So you can think that I can sanitize my hand, isn't it? Does it sound correct? Let me ask one small doubt. Sanitizing your hand before and after entering the room of a person who's having persistent watery diarrhea. Don't you think that sounds good? Yes or no? Yeah?
Yes, yes.
Yes. Okay. Placing the client in a negative pressure room. So we know that when we have to place the patient in a negative pressure room, do you think that this particular patient who is having a persistent watery diarrhea, do you think that person needs to be placed in a negative pressure room?
No.
No, definitely not. When do you place a person in a negative pressure room?
TB patients.
Yes.
TB
So
classes.
airborne precautions. So whenever the patient has an airborne disease, that time you go for this what? Isolation precautions, where the patient need to be kept in a negative pressure room. Then wearing a N95 mask and a face shield when entering the room. Do you think that is correct?
No.
No. So when do you think that has to be done again? Again, that has to be done for an airborne precaution. Use a single-use equipment and leave it inside the room.
No, we have to throw this, no? Single-use equipment.
Pardon me?
We have to use this single-use equipment and then we have to discard it. Why we will keep it inside the room?
No.
Single
Yeah. So I understood what you're trying to tell. So that means, here, what does it mean? Here, you know that the patient is having diarrhea. So here, the patient will have the risk of, here, the risk will be like if you use that particular equipment on this patient and you use the same equipment on the other patient, there's a chance for the transmission of infection. So they are telling single-use equipment means just use it for that patient and leave it inside the room of that patient. You're not going to take it outside that room so that it will be spreading for others. So it's a special entry precaution what you will be taking. See, A can also be right. But when there is an entry precaution, you are not just sanitizing your hand, you have to wash your hands with soap and water. That is why we do not choose that particular answer. There might be an answer which is looking similar, but there will be some kind of slight difference from that option to the other option. So sanitizing your hands is not a precaution that you should be taken when a patient is having an diarrhea. What you will be doing is you have to wash the hands with soap and water, which is very, very necessary. So that is why we are not choosing that. And B and C, though, we are not choosing because it's something related to airborne precaution. And D is why we are choosing. It is because it's a precaution that you give when a person is having something related to enteric problem. So for the enteric precaution, you see that the patient will, whatever you touch, whatever that person is using and you go and touch, you will have that thing of getting the infection. So that is the reason we always see that a single use equipment is being used. That means the patient's equipment is used there and it is kept in the same room and it is not carried to others. Got it? So we will be having these doubts. So only when we start attending the classes and only when we start learning each rationally in depth, maybe whatever I told you now, it's not that enough. So when we take the QA sessions, we will teach each and every QA and the rationale why this is wrong and why this is right. So then you will be understanding it more better. So as I told you, yes, NCLEX RN is a subject of nursing, but you need to go inside depth thinking of the critical needs of the patient. Critical thinking of a nurse is very, very important to meet the needs of the patient. So I would try to discuss one more last question and then we can call it for the day. Okay. So here we are talking about which of the following situations represent an appropriate time to place your client in restraints. Okay. So here we are talking about the restraints. So when do you use the restraints is what is the question. So select all that apply. So we are talking, okay, out of these four, there may be more than one option which is right. So what all you will be thinking of? So what you will be thinking is, let's read the option, then we go for the answering. So the first one is when they are trying to pull at their lines, tubes and drains, when their family members ask you to put them on the restraints. That is what it means. When you feel it is necessary or when they are in danger to themselves. So when we are using this restraints on a client that is related to your NCLEX RN, the restraint should be the last resort only when everything goes on in vain. So first you try to see that the patient is being taken care, that the patient is being safe and everything. In spite of doing all that, in spite of following the safety measures, still that patient is under danger. You know that the patient is going to harm themselves or they are danger to others, then only you will put them on the restraints. Got it? So in these four options, when their family members ask you, so that is not our priority here. That means when a family member comes and tells, see this, my husband or my brother or my son is being very aggressive, or my the so and so is trying to do this, trying to do that. So do you think that you will go and put the restraints? Definitely not. It is not like how others say. It is what you want. You see what is happening to the patient and then only you take a decision. Or it is not when you feel it. So feeling is something different from what is the purpose of doing it. So when you feel it is necessary is not the right answer. The reason is, it is like you feel that, okay, fine, now I will put the patient on restraints, you'll just put and go. It's not that when you feel. Only when you see that there is a need for the patient, then only you will be doing it. If it was a need is necessary, then I will tell that is the right option. But here it is not the feel, it is the need, what is necessary for the patient. So here we take the option A and D as a right answer. The reason is, in A, when they are trying to pull at their lines, tubes and drains, what happens? Their life is at risk. Because if they pull their lines, definitely it is going to hurt them. You know, there will be blood loss. You know, there's going to be some injury to them. So when the patient is at risk for themselves, that time you can put them on restraints. Or if they are danger to others, that time you can take this step. So here the option A and D is the right answer compared to C and B. So because it is not up to the family members to come and tell you to put the patient on restraint, or it is not when you feel you have to do, because there is a lot many procedures. So once you put them on the restraints, you have to inform the doctor, you have to make the documentation, why it was put, for what reason it is done, when it was put, how long it was put. So all these documentations are necessary. So just since you are feeling it, you cannot just go and put. Since the patient has a problem or the patient is a threat to others, then you go and put that particular restraint for the patient. Okay, so like this, before teaching, before going into any question, we teach the topic and then we discuss the question so that you understand it better. Okay, so with this, I stop here my small talk on NCLEX RN. Hope you people enjoyed the class in the morning session. And okay, all the best if you are taking a step to do your NCLEX RN in the future. Okay, then signing off from Gunajoti today. So all the best for your future.